welcome to Dr. Brumfield's Elite Athletics. I am Dr. Brumfield. Today we have Jasmine. Jasmine came in with her significant other, weekend warrior, who was behind, and she saw that he was having so much fun, so she started asking questions, and so here we are. So Jasmine is saying that she has neck pain, lower back pain as a result of having her daughter. She had an epidural. How's your daughter again?
6.
6 years old, and so you've been having pain ever since, right? What have you been experiencing?
Sharp pains, tightness, feel like I can't breathe, restricted breathing, lower back. I can't walk for too long.
Okay.
The extended walks make my back hurt.
Okay.
And she be hitting her inhaler a lot.
And I hit my inhaler.
So you have asthma?
Yes.
Okay, so what we're gonna do is, we kind of already done this, but for sake of you guys, we're gonna place her down on her stomach, prone if you will, and then I'm gonna do a quick scan and we'll see what we have. So let's go ahead and get back. No, don't worry about that. And so, what I'm doing first is I'm just feeling her spine. Why are you tightening when I do this? Does it hurt? Okay. So I'm looking for, I guess tone is a word. You know, your spine should go up and down. Areas where it doesn't go down, like this one here, then that lets me know that there's a problem there. This area is pretty good. But what I am noticing is there's some flatness right here in the thoracic spine, which could contribute to some of the breathing problems that she's having. But so far it feels good. Right hip is high. If you can come over here, come to the side. So if you look at the top of my hands from here to here, you notice that there's a difference in height, right? And so we got to address for that. And then, wow. So this sacrum here is out. So she is presenting, so she's basically presenting like this. Actually, no, hip is high, like that. And then this bone here, the sacrum, has come, instead of being flat, it's come forward, right? So that's how she's looking. So what we're gonna do is we're gonna take care of it real quick. I'm gonna start from here up, work on the neck, and then we're gonna work on the pelvis and the hips later. So let's see what we have. So take a deep breath for me. And all the way out. So you can hear she's adjusting relatively easy. Deep breath again, and out. Now that one bottomed out, so again, that's her trouble area.
When it bottoms out, what does that mean? Which
means once I gave her thrust, it was just hard as a rock. And so I don't want to pound on her to make her completely sore, so I'm going to work around her, and then we're going to do one other thing.
Okay.
There we go, nice adjustment. Good. So what I'm doing is clearing everything up top. Let's switch. What'd you say?
It's not to breathe.
Yeah, so what I'm doing is clearing everything up top, so that way it'll relax, because everything works together. Good. Deep breath, and out. Good. And then now we're going to come to the side, and I want you to turn on your side and face me over here.
Against the wall?
Yes. There we go. Bottom leg straight. There we go. So you already saw this, so you kind of already know what to do because of the Weekend Warrior, right?
Yeah.
So
DJ
if you haven't figured it out yet, this was the camera woman behind the 3-day, 4-day episode, the director, the producer, and everything else. So take a deep breath for me. And just relax. Don't hold it, just let go. Deep breath and out. Good. Turn and face me this way. And for the record, never mind the gel stain. You know, it is clean. But I had another patient and I got splashed with the gel, but it's all right.
As long as it's gel, doc.
Right. I thought it was ink for a minute there. There we go. Hug yourself. Same way. We're good. There we go. Good.
I heard that one.
Here, so now, so lay on your back.
Okay.
I'm gonna pull you down a bit.
Hey, Jasmine.
And we're gonna clear you out all the way.
You want me to move the camera now?
So normally, you can just get on her face and all of that. Normally, I would use a towel to do this, but I went ahead and got a little adjusting apparatus. And it's interesting because Jasmine saw it. She's like, hey, that's that thing. That's that thing. I said, well, yeah, you're going to get that thing. So guess what? So let's lift your
Got
braids
that
up
thing,
in here.
thing.
Let's
She's
lift it up so I
excited.
can get underneath. Yep. Drop your head. Just like that. Look at it. Look, she ready now. Hold on, we need to flip it around a bit. Give me a sec. I'm attaching to your braids.
Ripping out my new growth.
There we go. Hey, new growth is good. It'll grow back. It'll grow back. All right, so we're just gonna lock it down a bit. There we go. Make sure it's even. Put the chin anchor on. We want to make sure she don't run.
You look like Forrest Gump.
And so what we're gonna do is just a little traction, if you will. Open her up.
Oh my God.
How you feel?
Run, Jasmine, run.
Oh my God.
So tell me, what do you feel with that?
I feel so good right now. I can just breathe. I'm sorry.
You about to go to sleep?
You want to get up or you want to sit there for a minute?
wanna lay here.
You want to lay? So talk to us. What did you feel?
I felt a lot of pops.
Okay.
Your before and after, though.
Huh?
What was your before?
Well, before I felt like restricted. I felt tight, like I couldn't breathe. Like I said, I had a little bit of lower back pain.
Okay.
But after now, like I don't really feel anything.
The funny thing is I don't know if it's just me or not, but even your sound, your breath sound has cleared up.
Yeah.
You're clear. Before
Yeah.
you sound a little congested.
Right. I feel like I couldn't breathe.
Yeah. So we're gonna sit you up. Can you move your toes? Okay, I didn't break anything if the toes are moving, so we're good. So turn and face me this way.
You excited?
Yeah.
I'm just gonna double check to make sure I didn't miss anything. Just a little bit. So just drop your head in my hand. Just relax. Good.
So that could have literally been the cause of all your fake asthma attacks.
Well,
He said straight up.
yeah, I heard you. Right? That's why I said, well, I have to take a breath real quick. Just relax your head. There's tension. Just relax. Let me move it. Good. Yeah, I heard him say fake. He trying to play you on
Yeah,
camera.
he really did. He just trying to get back. I mean, so he was crying.
Let me use this as a teacher moment. Let me help you out here. So, if you,
Get him.
so if you look over here, right? So you see, this is the autonomic nervous system, right? So we have the regular nervous systems, parasympathetic, autonomic, all of that good stuff, right? So you see it says T1, T2, T3, right? And these are the nerves that comes out of the spine at that level, which means thoracic. Incidentally, the area where I said she has a block is about T2 through T4, and look what it supplies. T2, T3, T4, where does it go to?
To the
It
lung.
goes to the lungs. So we have opened up those channels, right? And given her a little bit more passageway in terms of the nerves. Because if there's compression there, if there's block, then it's not going to function completely normal.
Right.
There's going to be something there that's going to be showing up as a result of her saying, hey, I'm quote unquote subluxated, which is a word that we use, which is a fancy word for saying the bone is out of place.
Right.
All right. So how do you feel now that we're done?
I feel great.
So if your spine, I'm just asking you personally,
Okay.
but so if your spine is connected to your lung, why couldn't a
spine
doctor?
is not connected to your lung. It's the nerves. that we're
Okay,
talking
the
about.
nerve.
It was the nerves.
Okay, so if the nerve is connected to your lung, why couldn't another doctor diagnose that and figure that out? Because she's been going through this for a long time.
Have you read?
Yeah,
You did, Jenny.
I have.
Okay. Well, here's the thing. It's not why couldn't the other doctor do it. It's based on training. Now, if you put me into a surgical suite and getting ready to do surgery, I'm lost. I wasn't trained that way. as a chiro, I'm trained to look at the bones first.
Mm-hmm.
And I know that under the bones or you have nerves, and those are attached to muscles, and they all work together. That's why we have the neuromuscular skeletal system, right?
Mm-hmm.
That's the nerves and the muscles that are working together. So you can't fault another practitioner. They weren't trained to look at that way.
Oh, okay.
And that's really the way it is, right?
Okay.
We good?
Yeah.
Any questions?
Can I come back?
Yeah. Absolutely. We're done. Thanks, family. Don't forget. Did you hit record? You pause it?
Nah, I don't think so.
Do you see me?
Yeah, but it don't say record no more. Oh, yes, it do.
Okay. So that you know that's a blooper reel, right? So, family, don't forget to subscribe. Don't forget the bell for the notifications. You can also go to I am Dr. Aaron Brumfield on Instagram and follow us. If there's a question, look at she lit up, right? So if there's a question or a topic,
you lit up?
if there's a question or a topic that you haven't seen on our channel, feel free to send us an email. We'll be glad to research it and get back with you with a video or some of those things. And I'm waving at all the people because we got the window open. They're walking by waving. So
Hi, old white lady. It's a blooper reel.
you just ruined my video.
You know I did.
So we're good. Thank you. Take care.
I'm the best camera.